All right, so how many of you have a hard time getting into a doctor? When you do get into a doctor, you feel like you're rushed for time? Yeah? Just a couple? Most people? Yeah? So getting in and talking to a quality healthcare professional can sometimes take a lot of effort, a lot of planning on your part, especially just for yourselves. And then when you bring the caregiver, you know, the person you're caring for into the picture, it can be exhausting. So we're just going to go over some basic information and kind of when you meet with your healthcare provider, things you should remember, things to consider, and things that will hopefully make your visits with your doctor impactful and you can get the most bang for your buck. All right? So ultimately, working together as a team equals optimal health for your loved one. That's the goal. If you can all work together, know what's going on for your loved one that you're caring for, know what medications they're on, have a running list, keep everything organized, are we better apt to have a more successful relationship with your healthcare provider? Yeah, it takes both parts. It's not only the doctor's responsibility and the nurse's responsibility to have everything organized and on tap for you guys, but it's also important that you guys are proactive and you come into things prepared, whether just for yourselves and in this circumstance for your loved one. It's very important to be prepared and to be very organized. So how well you and your doctor talk to each other is one of the most important parts of getting good health care. Would you all agree? If you feel confident that you can speak with your doctor openly and without prejudice and that they're just going to listen, are you better apt to tell them things that maybe you would feel not so comfortable about or things that, you know, are bothering you but you just don't want to disclose? Yeah, and it's so important to have optimal care if we can be open and direct with them because that's their job. But they can only do their best job if they're getting accurate information from all of us. You know, it's our job, too, to be open, honest, and really use that time effectively when we're meeting with them. Any questions so far? All right. So choosing a doctor you can talk to, very important. How many of the loved ones that you're caring for have doctors that they've seen for years and years and years? Anybody? No? Couple? Yeah, so you already might have that relationship established, but it's still okay to kind of question some things. It's always okay to look at what's going on in the medical field, to make sure your doctor is up on things, to make sure that they are taking the quality of care for your loved one very seriously and they're just not another number, right? So decide what you're looking for in a doctor. If you're needing to find another doctor, if you're looking in the community, probably one of the most important parts is to make sure your insurance provider is covered under them. Duh, right? That's probably very important, just so all of that medical information and all of that stuff isn't a headache for you and your family. You can avoid all of that if you know right from the beginning insurance provider is going to cover that quality health care. But you also want to know your family values and what's important. What kind of doctor, what's their background, what's their history, what did they study, what's their specialty interest. All of that is really important. Okay. Sorry. Okay. Okay. Identify several possible doctors. So it's okay to kind of have a list of doctors that you want to consider and go around and interview them. How many of you think that idea is silly or you've never considered it? I know. Right. But you can really feel confident in, knowing that you don't have to stick with that doctor. If you feel like that doctor isn't doing what your family needs, get up and walk out and say, we need to find someone that we feel comfortable with because it's your health care that's at stake or your loved one's health care.
How do you find that person?
How do you find the doctor that's that person?
I went through two that were terrible.
Right.
And now I'm looking for a third, and I don't know where to look or how to look or anything.
Well, I think maybe one of the best resources are your friends and family. They can be the best resource for quality information and who they trust. Yeah?
There are websites, too, that have people's input about
rating the doctor, and yeah. So if you have internet access, you can do that. But for the most part, I would say, the social connections that you have. Do you belong to a church? Yeah, so you can talk to those people Do you have friends, family, or acquaintances that are local here in town?
My family goes to the IMA clinic.
Okay,
And that's where I end up because the doctors I choose can't get to me.
right.
Sometimes asking other providers that you trust as well can be helpful if you're looking for a
Sort
physician.
of leery about suggesting anybody.
I have
They
people-
shouldn't be. They should not be. I know when
I
I've,
can tell you if they ask. I have people that call me all the time and say, "Is there a doctor in town that knows about Alzheimer's disease?" You know, or they might call me and say, "Is there a doctor in town who will be willing to spend more than that 10 minutes with me?" And typically, especially if it's a family that I know, I feel like here's a person I can send you to. Barry, in fact, I had talked with him about a physician here in town because they were unhappy with who they were with, and they switched, I think, still successfully, right?
No.
Okay. I should have probably asked that before.
It may be a little one-sided, but it's working.
Right.
oh, good.
Yeah.
I think that's kind of
Yes.
the nature
And
of the
and the
disease.
next visit is on the 29th,
Yeah.
the POA's birthday.
Yay.
Now, I have specialists. But I need a general.
A healthcare
I have
physician.
two wonderful specialists.
And you may ask those specialists, here's exactly what I want from a general physician. I want somebody who knows about X, Y, or Z, or I want somebody who spends a lot of time with his patients, or I want somebody who will call back personally. And, you know, they know those other providers.
I asked one, and he wouldn't say anything.
Yeah.
Aw.
The other lady gave me a name, and I lost it.
Oh,
But I'm gonna see her.
call and
Wednesday.
ask again.
Yeah. You had a question, ma'am?
I have to have it wrote down. She wrote it down, and I lost it.
211? Excellent. So 211, Lola, would be helpful as well. 211, calling that resource.
Is that what it is, not 112?
211.
211, yeah.
211?
Uh-huh. I would say that could also provide you some resources. Thank you for that. I would say don't give up. If you're not happy, just keep searching. Yes.
Well, I will say, several years ago, our physician passed away. We were in that situation, and it takes a while. It took us about 6 to 8 months to really find a doctor, but we just kept going to one, and I'd go on a visit, and Mother would go on a visit, and then we'd compare notes, and like, well, do we like that one? Yeah, I think maybe we do, but we still kept looking, and after about 6 or 8 months, we found one we really liked.
Good.
Yeah, we also talked to people too, and the funny thing about it was the one we finally wound up with was one that initially we didn't want to try to because we had some people saying, "Oh, they're the worst doctor
You
we
heard
ever
rumors.
saw."
Yeah.
And other ones were saying they were good, and I said, well, they're a mixed bag, because all the rest of them we had, everyone either loved them or they hated them, and we wound up with the one that was just the mixed bag.
Absolutely. Well, that's good to know. You just have to keep trying.
Yeah.
So consult reference sources. So we've talked about this, including but not limited to the internet as well. So like you were saying, you can check out the internet if you have internet access, your insurance provider, local friends and family. Talk to the office staff to learn more about the doctors you are considering. So whatever healthcare provider you're wanting to go see, talk to their business manager, whatever, and just kind of maybe get a feel. And they're not going to tell you, oh yeah, the doctor, really stinks or is really great. They can't do that professionally. But you can probably get a sense and just follow your gut instinct. If you feel that the office is going to be welcoming, inviting, take care of your needs and not be just so business oriented. Does that make sense? So you can get a feeling of that a little bit. And then make the choice that suits you and your family's needs, and realizing it might not be that first time around. It might take time, but be willing and take the authority for your family to leave if you have to, or find another one so you're having your needs met, so there's never a question. So making good use of your time when you are at the doctor, I think this is really important and some really important reminders. Be honest. Be honest from the beginning and tell them everything. I know when I go to the doctor, it's not that often, but I have to keep a list throughout the year or whatever because I won't remember everything I want to talk to the doctor about. But I'm also really good about calling the doctor if I have questions throughout the year and asking the nurse or asking the triage department or whatever. This is going on, is this normal or whatever. So be completely honest from the beginning. Decide what questions are most important. So keep that running journal. Keep that running list of questions so you don't forget anything when you're in there. Stick to the point, realizing and respecting the doctor or physician's time as well. You know, keep things on point. You know, ask them questions that you need answered right then and there, and kind of avoid, you know, the socialization once you feel comfortable with the doctor. In the beginning, it's important to build that relationship, absolutely. But you also want to make sure to know you are there to get your questions answered and your health care needs met. Share your point of view about the visit. So talk to the doctor or the nurse and say, you know what, this was a really great visit and thank you. Or if it wasn't, don't be afraid to share with the nurse before you leave or the office staff and said, you know what, I didn't feel comfortable that happened, or I felt like I was really pushed out the door. If you don't speak up, they're not going to know. They're just going to continue to go on throughout their days and thinking that everything went well if we, as the public, don't speak up during the visit or after the visit. And remember, the doctor may not be able to answer all your questions. So even though you go in with a notepad full of things, they might have to get back to you, or they might have to consult with a specialist. But just being aware that they are people too, and they have to maybe look up a question or get back to you, and don't get frustrated if they have to get back with you. But also, take the responsibility for your family to follow up with the doctor's office. If you don't hear back from them, if they didn't look up the question and call you back, it's okay for you to follow up with them and say, did the doctor get this question answered? He was going to get back to me after my visit. Any questions so far?
I have a question. I'm a physician,
Okay.
so, and I work in the emergency room.
Okay.
So sometimes people come and ask questions that I don't know.
Right.
I wanted to know, do people feel it's good or bad for the doctor to consult WebMD in front of them?
I would say that probably, I've never seen that happen. That I don't know if that would be, if that's considered best practice for physicians. I'm not an expert on physicians, but are you saying you've seen doctors do that, or
I've done it.
you've done it?
Because I say, that's a question I don't know, let's look it up.
Okay. I would say that's more of a question for a physician and how they have their bedside manner. And I don't know how you all feel about that, but I would think that would be a personal decision from the individual at the visit. I know personally for me, I don't know that I would feel comfortable with that just because I would want them to consult with other doctors, but I'm more of a research mindset where the average person coming into the ER.
You don't have access.
Right.
We
So
don't have much more access to all these other physicians than you do.
right. So I would think that would be a bedside manner question that you can discuss with other physicians, and that would be a personal call on your call. So be prepared. Keep a journal. We talked a little bit about that. Keep a journal throughout the year. Prepare a list of topics and questions. Very important. You're not going to remember everything when you get there, when you waited 30 minutes and then another 10 minutes on the table. You know how it goes. Bring an updated list of medications. Include dosage and frequencies. Very important for your loved ones that they have all of that documented. And even just put the bottles of their prescription pills in a clear Ziploc baggie so everything is right there, so there's no question that they've written something down wrong or something hasn't been recorded correctly. Bring in any recent test results or other important documents, lab results, x-rays, everything. And if you are switching providers at any point, know that it's your right to call the doctor that you used to work with and have all of your files sent to the other doctor. That's your right because you can save money doing that. You don't have to redo all of those tests just because you're at a new doctor or dentist or what have you. It's your right as the patient to get all of your documents sent to the other provider so it's all there when you have your first visit or your other visit. Does that make sense? All right. So write a letter to precede your visit. If you have comments or thoughts and you didn't get things out when you were there, you can always, this just goes back to the point of you can always voice your opinions and your concerns. How you feel after the visit and if you got your needs met and you were successful is the most important thing. And then bring someone along to help you ask questions and remember important information. So how many of you go to the doctor with your loved one? Yeah? Good. And do you feel like their care is better because you are there? Yeah. There's a lot of things that would go unsaid or you would have questions about. But this is also a very fine line because they want to maybe keep some of their independence, right? So having that conversation with the loved one prior, if they're cognitively able, this is my role, this is how I see myself, I'm going to sit there, I'm going to listen, but you're still going to kind of, drive the car, so to speak. I'm just going to be there, so an extra set of ears are there to hear what the doctor is telling you. Is that okay with you? So it depends on your individual circumstances and where your loved one is at cognitively with their mental processes. But it's always great. Even me, I always love to have my husband or someone there with me to listen because half the time I zone out. So it's just nice to have someone there with you. Beep.
I even bring my daughter,
You bring your daughter.
so there's 3 of us in that room at the same time.
There you
I
go.
have to pick a doctor with large waiting room.
There you go. That's even better. As long as you all know your roles and you're speaking at appropriate times not to overwhelm the doctor. Excellent. Yes.
I also want to stress when you're talking about medications, or list of medications, frequently people forget about all the extra vitamin E they take or any kind of supplements, because that greatly affects
Their overall health care. Yeah.
blood thinners and just
Great point.
everything you take, not just your prescription drugs in over the counter.
Excellent point. Your multivitamins, everything should be included in that documentation to your doctor. Yes.
I also keep a list that I keep updated and then have my mother-in-law carry it with her because I'm not always with her. And other
Excellent.
people are, and they're not, things like a fact of life file. And so, because she won't remember what she takes and when and the dosage. But
That's an excellent idea.
when one's around, there'll be a resource on her.
That's excellent. Did you all hear that suggestion to have your loved one carry a list of medications with them in case you're not around? They always have that as well. All right.
I think, I think there's something else important about having your children or whoever else is responsible for the person to be with the doctor, especially the neurologist, when the neurologist does the testing that they usually do about what the month is and who the president is and so on. For me, it was important to have my children there so that they knew how well he was or was not. And I think that's important, and rather than my going home and saying to them, this is the stage we are now.
Yeah, that's fantastic. And that goes back to your family values, and that's important to you guys, and you have that ability to have your children, they're here in town, I assume?
Well, yes, but even with the ones that they could then convey that to the ones who are out of town.
Yes.
So it's instead of just me reporting, it's them. And then I was going to say one other thing about calling the doctor. For a while, for some years, I was really turned off by calling the doctor and always being given to his nurse. But it works very well. You call the doctor and say, I want to talk to Dr. So-and-so, and they say, I'll give you his nurse. That's just fine. I've been very happy with that. I wanted to add a different medication and wanted to ask the neurologist if that was okay. And I talked to the nurse, and it was just as well. And I do
Absolutely.
this with my other doctor, too. I'm as well acquainted with the nurse as I am with the doctor.
Yeah, because if they have questions...
People should be put off having given to the nurse.
No, doctors are very busy, and they don't have much. They're in and out of, whatever kind of doctor it is. If it's just your primary health care physician, if it's a specialist, they're even more crazy with their schedule. So it's important to also trust the nurse, and that's a great point, and to be able to call. And the nurse should always, if it's not a question that she can answer, on basic, dietary needs or basic care, she should be consulting with a doctor and getting back to you. And say, I'll speak with the doctor and call you back, and not making a lot of those big calls on her own. So you're still having that interaction with the doctor, not necessarily one-on-one, but she should be consulting with the doctor to discuss things as well. Yeah.
You're talking about being proactive here. I had, basically.
And that depends on the situation too. If it's a question that needs immediate attention to, that's something that you can definitely voice your opinion on and ask for that care. But if it's a question that, maybe is just, this is going on and it's not something dire that you need to consult, the emergency room or something with, we also need to be respectful of their time as well and know that they will get back to us in a timely manner. See, and that's a different situation. If you've kind of built up that attitude with them a little bit, then that's different. But hopefully we respect their time and they'll respect our time. So being proactive, ask for a longer appointment slot if possible. If you know you have a lot of questions, this is a hard one, and it's hard to go into appointments, to ask this. But if you really feel like there's a lot you have to cover, feel free to voice those concerns, but also know that it goes both ways. And if they say that's not possible, then say, well, then next time, can we go ahead and look to the schedule and schedule something next time? Be proactive about it. Don't necessarily settle for their answer, but be respectful of their answer as well, because, you'll catch more, bees with honey than you will with vinegar. So if you're nice to them, it's just with every relationship. It's a give and take for sure. Give pertinent and important information. Don't wait to be asked. That's why you should have that list. You should be giving that information and divulging that important healthcare information right off the bat, not waiting for them to ask every question and then you have to remember what you wanted to ask them. Ask questions. Of course, it's your healthcare. It's your loved one's healthcare. It's very important to be proactive and ask those questions because, like Dana said earlier, they can't read your mind. They can't know what's going on. They have a lot on their plate, just like you all have a lot on your plate, and we have to be respectful of that as well. And ask for a diagnosis. If there are things going on and, they're maybe asking you what the symptoms are for your loved one or what's going on, maybe say, have the confidence to ask, okay, so maybe where is this leading? Where are some possible diagnosis, or areas that we're maybe talking about with these symptoms, and have that conversation and be proactive about it. Just don't wait for them to, see you for 5 visits or see your loved one and say, okay, this is what you have. Be confident to have the courage to ask what's going on. Be direct. We've talked a lot about this already. It's important to tell your doctor personal information, sometimes even though it may be uncomfortable or difficult, especially for your loved one. And I think that goes along the line of if they're cognitively able to have that conversation, that you have that conversation with them to know what's your role as the caregiver to talk to the provider and say to the provider, and what do they want to say and what do they not want told. If there is anything that makes them uncomfortable. That doesn't put their health care at jeopardy, of course. But being respectful, if your loved one is still cognitively able to express themselves, say their opinions, talk about their needs and their feelings, give them that chance too, because that's important that we don't take that away from them. Let the staff know if you need special accommodations before the visit, if things have changed, if you need a special chair, and so they will work with you. They can't read your mind. They want to be there and work with you, but it's a give and take relationship, absolutely. And we have to be confident enough to know we can ask for things and talk about things, and they might necessarily all happen. Don't worry about asking silly questions. I always feel like I ask silly questions. Silly questions can make a difference during the appointment. If you think it's something silly, it could be something that really makes your appointment worthwhile and you really get a lot out of it. So never question yourself. It's your time to ask, and it's your time to speak up for your loved one. Be specific. Come armed with examples of change in these areas of health, behavior, mood, and cognition or mental processes with your loved one. So it's important that, like you were saying earlier, you have a loved one in there with them. Maybe it's 2 people, the spouse, and then maybe the child, just because you can kind of have different views of different changes. But it's also important if you're going to have more than 2 people in the visit with the doctor, that if it's the spouse and a child, they have a conversation before the doctor visit, so you're not kind of railroading the doctor, and saying, but this happened, no, this happened, Mom, and just, you don't need to have that dialogue and that conflict in front of the doctor. You should go into the visit prepared and talk about, this is what we've seen, and this is what, we've kind of noticed, and you'll get more out of it. Remember, always remember to discuss what's going on, and discuss what's going on with your loved one. Restate, repeat yourself, because the doctor only has limited time with you. So even if you feel like you're repeating yourself, it's okay to say, "Are you hearing me?" Like she was talking about those basic communication skills. So when I leave here today, this is what I need to do with Dad. We need to do A, B, and C. Am I correct? And just talk it out. And even if you feel like you're silly or asking too many questions, you're going to have the best care if you leave the visit feeling confident. Don't we all feel better when we leave a doctor's visit knowing this is the next step? and this is what's going to happen, rather than, now what just happened in there? What do we need to do? You don't ever want to feel like that. I know I don't. And then agree upon specific action steps before leaving, like I was saying. This is what we need to do. Always be informed. Take lots of notes. You can even feel free to take notes during the visit. If you're there with your loved one, sit back, or if you're lucky enough to have maybe 3 people in the visit, give someone that job of writing things down and taking notes. Ask for written instructions for medications. Next step, follow up with specialists. This is really important. When you're given a list of things to do after the visit, you're not going to remember when you leave, probably. So have the nurse or have someone write it down. A lot of the times now they give you printouts of, this is what you've been diagnosed with and this is what's going to happen. So you get a lot of paperwork anyways, but just make sure you're leaving the doctor's visit comfortable with what's going on. And then if you have any questions, make sure to always research what you've been told. Call around, ask questions, ask for second opinions. Don't just, take everything in and think that's the ultimate word, because you may have more questions that need answered. And then lastly, building a partnership with a physician that addresses the health needs of the care recipient and the caregiver is crucial. Would you all agree? Very, very important for your loved one. The responsibility of the partnership ideally is shared between the caregiver. Like I said, it's your responsibility as well to be proactive and to ask those questions and not just settle for things. If you have a pit in your stomach about something or something doesn't feel right, be proactive. And then the physician about the one being cared for. So always speak up, have that conversation with your loved one, and know that you guys are on the same page for their care. It's very important. Yeah.
I just had a question. We're talking about the diagnosis and leaving the diagnosis. I don't know if you would know this or if the doctor would know this. What do you do if you feel like it's not the correct diagnosis? An example would be a 95-year-old woman that had a fall and they put her on a pain medication she's never been on. She presents at the ER with confusion and gets diagnosed with dementia from that one encounter.
Wow.
And then come to find out, no, it was the pain medication. Is there any recourse for the family to?
Okay, so the question then, if everybody wanted to hear about it, was what if you don't agree with the diagnosis? So you said that there was a 95-year-old woman that came in, got put on a pain medication after a fall. They diagnosed her with dementia based on her resulting confusion, ended up being the medication. So one thing that I can say is that, I like the idea of a second opinion, particularly in a situation like this. It's one that I feel very strongly about because I know a lot about delirium. And so to me, those red flags would be going up. So the other thing is, within that moment, I wouldn't feel bad to kind of speak up about, you know what, this is a one-time thing. This just started. She was cognitively fine ahead of time, because I think it's very easy, especially in an inpatient situation, to look at somebody at a glimpse, especially a 95-year-old, and say, oh yeah, this looks like dementia, because it does. Yeah. It does. But I think as family members, we need to say, whoa, 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 whoa.
We know our
I know
loved
a
one.
little bit about
Yeah.
that, and this is a new process.
Can you do anything about it though after the fact?
You can go get a second opinion, or sometimes even within there, if it's a big enough hospital, you can say, is there another physician or PA or nurse practitioner or somebody that we can discuss this with before we leave?
But let's say, it's after the fact, it's
Yes.
several weeks later, and that's in your medical records, with insurance and everything being the way it is, now that follows her forever.
Yeah, I think that probably something like that, when you're talking about it being part of a larger record, you'd have to challenge with the insurance company, and you'd probably have to get another physician to say, I've looked at this on a broader scale, and it does not look like dementia. It's hard.
So many people that have all these diagnoses, and they say, well, I never knew I
You bet.
had that.
You bet. Yeah, do you want to speak to that?
Yeah, I think it's a fault of the physician to make a global statement. There are certain diagnoses. If a person comes in, like certain diagnoses, like maybe it doesn't apply here, but I never on a one-time encounter make the diagnosis of asthma, because
Can you hear him?
because that affects the record. You don't always, unless you see a seizure, you don't put seizure, because once you put seizure, then the person can't get a driver's
Right.
license. You don't put dementia.
If,
you
however, people are not as conservative as you about that, he said there are certain things he won't diagnose on a one-time basis, like asthma or seizure, unless he saw it.
or
If that has happened, though, from another physician that maybe is not that conservative, what would you recommend for the family to do to follow up?
Well, they'd have to, that would be, it's harder to get it off the record than to put it on the record.
Yes, it is. I think that was her point.
And I think, like in the case of medication, we were warned about certain things. I could put altered mental status. That would be a correct diagnosis.
Yeah.
I mean, because what I'm seeing, they do have an altered mental status, whether that's a.
I don't think there's any question that maybe that was the wrong thing to document. I think the difficulty is how do you get that off? I'd say that you can get a second opinion. I'd say that you can challenge it with the insurance company with the backing of another physician that maybe says, no, there was altered mental status. But it's very hard, though, if the physician maybe wasn't there.